Our esteemed guest, Dr. Rekha Geriatrics, Brook Jewish Medical Center. We would now request Director General BSF to welcome Dr. Bhandari by presentation of the bouquet. And now request MBBS to also welcome Shri Rekha Bhandari by presenting a bouquet. Thank you, sir. Ladies and gentlemen, today we have the privilege of being addressed by Dr. Rekha Bhandari on the topic of successful aging. As we all know that aging is a natural phenomena, and with aging a wide range of changes occur in our body. The aging process, as we know presently, is irreversible and cannot be stopped. However, being aware of these changes and adopting a healthy lifestyle, we can reduce their impact on our overall health and well-being. We are indeed lucky to have Dr. Bhandari amongst us, who has worked extensively in the field of geriatrics. She will be sharing her valuable experience and will enlighten us with her wealth of knowledge in the field of successful aging. Please join us again in welcoming Dr. Rekha Bhandari once again. I would now request the Director General BSF to introduce the speaker and deliver his welcome address.
Dr. Rekha Bhandari, Shri Rekha Bhandari, ADG Operations, Financial Advisor BSF, President Baba, esteemed members of Baba, senior officers, our distinguished veterans, ladies and gentlemen. We are greatly honored to have Dr. Rekha Bhandari, MBBS, MD, Chief of Geriatrics, Brook Jewish Medical Center, New York. Her area of practice include internal medicine, geriatrics and palliative care. Dr. Bhandari is affiliated with Brooklyn Hospital Center, Brook Jewish Medical Center and Wyckoff Heights Medical Center. In addition, she serves as Chief of Geriatrics at Brook Jewish Medical Center. Dr. Bhandari has worked for more than 20 years in the field of internal medicine, geriatrics and palliative care. Dr. Bhandari is recipient of many awards such as Excellence in Medicine, Best Teaching Award and the highest civilian award, that is Ellis Island Medal of Honor. Incidentally, 6 former and the present US President-elect have also received this prestigious award. Dr. Bhandari was also a panelist speaker on aging and best practices at the United Nations. She has delivered a number of medical talk shows on graceful aging. A report jointly brought out by United Nations Population Fund and HelpAge International says that the population of our country will increase by 60% between 2000 and 2050. But the number of elders who have attained 60 years or more will shoot up by a staggering 360%. The share of India's population age 60 and older is projected to climb from 8% in 2010 to 19% in 2050. This profound shift in the share of older Indians has its impact on changing family relationships, and at the same time it poses a variety of social, economic and healthcare policy changes. BSF, starting with just 25 battalions at the time of inception in 1965, has grown to a hefty 186 battalion strong force today. It is considered as a premier border guarding force of the nation. It has been entrusted with the responsibility of guarding 6,623 kilometers of Indian boundary with Pakistan and Bangladesh. Today, BSF is more than 2.5 lakh strong force and is considered as the largest border guarding force of the world. One of the glaring reality of this force is that more than 50% of the strength is above the age of 40 years. Lifestyle diseases and stress-related problems are also very common in the force. Considering the magnitude of the problem, as the Chief of Force, I find it most challenging to keep the force fighting fit and in high morale. As we know that the average citizen of India is enjoying a longer life and better living conditions, and as a result of there is increased life expectancy. Increased standard of living as well as medical advancement is also there, and which contributes to increasing life expectancy. Despite the efforts of the government, the elderly population lacks the security needed in old age and live with low social status, with increasing reports of financial deprivation, abandonment and humiliation. In the recent years, successful aging has become a familiar term amongst gerontologists. It includes three main components, that is low probability of disease-related disability, high cognitive and physical functional capacity and active engagement in life. It is therefore of importance to have a holistic view of what contributes to aging successfully, and I think there is no better person than Dr. Rekha Bhandari to educate us on this important subject. Now I would like to say a few words about Mr. Bhandari himself. Shri Prem Bhandari is a non-resident Indian businessman and a philanthropist. More than 60 members of his extended family have become US citizens, but he is still continuing with a green card and by choice. He has been giving aid to orphans, widows, people stranded in Saudi Arabia, and helping the Dalits in a very big way. He is actively associated with the recognition of Rajasthani Bhasha as official language. And last but not the least, he is chairperson of Jaipur Foot US chapter. Jaipur Foot has provided artificial limbs to lakhs of people the world over. Now Jaipur Foot has come out with an advanced artificial leg in collaboration with Stanford University and MIT of US. Shri Bhandari has declared that he would provide artificial leg to any Jawan of any CAPF through Jaipur Foot, United States, free of cost. We are thankful to him for this gesture. Incidentally, during the floods in J&K in 2014, he had also contributed clothes worth rupees 25 lakhs. I am really proud of my association with the Bhandari family for the last more than 25 years. Now I welcome Dr. Rekha Bhandari to address the gathering. Thank you.
Good morning, everyone, and I really appreciate for all of you being here on a weekday and giving some time on hearing me out on successful aging. I thank BSF for providing me this platform and sharing my experience and the current recommendations on how we successfully age, especially the acknowledgement to DG Shri KK Sharma, President Baba, for all the support and what I've seen, thinking totally out of the box and bringing healthcare as one of the mainstream importance to the staff of the BSF. And so without any further ado, let's, and I'll also acknowledge all the dignitaries who've been here, and I really thank all of you for your time. So successful aging. So it does refer to physical, cognitive, and emotional health together. The concept of successful aging can be traced way back in 1950s and 60s. However, recently you see a significant growth and importance and focus on how we all age successfully. The MacArthur Foundation study has actually brought in the triad of successful aging. Number one being the absence of disease, which for most part is in our hand, and there are times, at least I would say, 20 to 25% might be without our focus, or it's going to be beyond our focus of healthcare. High physical, emotional, and cognitive functioning, and also to maintain the engagement of life is extremely important. So, Mr. K.K. Sharma Saab did touch on the census which we are going to face within India. The current documented elderly, which is by the World Health Organization definition, is 65 and above. We have around 80 million seniors within our society. Projected growth is around 300 plus million by 2030, and this is just around the corner. It's next 15 years. So this is an epidemiological transition here. We are seeing westernization, we are seeing urbanization, we are seeing a shift of medical illness moving from infective disease to heavy burden on cardiovascular disease and other major issue with urbanization. So this actually is more for the concept of how we all think. So here was someone back in the days, and here we still think that we all, unless and until we decline completely, we think that we are in a good shape, we are in a healthy shape. So I'll come back to this slide. I see majority of our audience here, except a few numbers. We all belong probably somewhere in the middle here. So if you have someone who's younger, the perception is things health-wise will change in the next 60 to 70 years. Meanwhile, middle age, we think that health-wise we change in the next 30 to 40 years. My senior patients, they know that the imminent and the transition is going to happen anytime soon. So just to touch base on various diseases and the age groups, I mean, on an average, probably by 50, 55, you're seeing a lot of these chronic illnesses onset coming in, whether it is arthritis, whether it is diabetes, whether it is hypertension, or whether it is heart disease, somewhere between 50 and 60, and you see an exponential growth of these diseases. The cancer, I mean, you've seen an exponential growth of oncology burden in Indian society. The research is yet to be invested into research on what's going on, but meanwhile, the disease burden starts somewhere in mid-60s all the way up to 80 and 90. The incidence of oncology and cancer burden increases exponentially. So coming to the first aspect of successful aging, which is physical health, correct? So the goal, of course, is to decrease the incidence of chronic illnesses. When I say chronic illnesses, even though I'm focusing on non-infective diseases, India and South Asia has become the capital of diabetes, correct? I'm talking about hypertension, high blood pressure, I'm talking about high cholesterol, I'm talking about diabetes. So the incidence creep up significantly once we turn in mid-40s and late 50s. So it's extremely important for all of us to maintain regular exercise, even though I'll come to this in a little more detail. Appropriate nutrition, focus on prescription and non-prescribed medications that we all take, as well as regular medical checkups. What I see is Indian health state is in reactive mode, meaning we all reach to healthcare providers when we all sick. There is no proactive mode. There is a legislation which is extremely important, which needs to be implemented from a healthcare delivery perspective, that prevention and screening should be the quality indicators for all providers. I'm talking about government, non-government healthcare facilities, and there should be a focus on prevention rather than treatment mode. And currently our society, or healthcare society, is based on treatment mode and reactive mode, and which probably, if you're looking at next 20 years, it's non-sustainable. So for all individuals who say I do not have time to exercise, that includes our own family members. Here is a cartoon there, a physician telling a patient that what fits your schedule better, an hour a day or being dead 24 hours a day. So we need to advocate for our own health. We need to invest in our own health. I mean, it's very important that we take out time to invest in our own health. I heard of one of the family members recently saying that, the next generation will take care of us. I would say we take care of ourselves as long as possible. The less we depend on people, the better for us. So, exercise prescription. I get asked multiple questions, and what kind of exercise should we do? I mean, we are 50-year-old, I'm 60-year-old, I'm 70-year-old. It's very individual. It's single patient-centered, individual-centered prescription a physician should go through. Now, there's a lot of debate on which one is better. The yoga is better, Pilates is better, Tai Chi is better, cardiovascular is better. Each one of them has their pros and cons. I would say every kind of exercise has its own benefits to all of us. Starting from endurance, we need to have the heart exercise. We need to have the heart work. So we need to have at least walking. If people can run, run. If you cannot run, jog. If you cannot jog, walk. If you cannot jog, at least do some kind of swimming or any kind of simple cardiovascular exercise. The next question comes, so how long should we do? What is the ideal cardiovascular exercise that we all need? If I have to quote American Heart Association, it's 30 minutes, 5 times a week. Even though American Heart Association recently revised that into 45 minutes, 5 times a week, I would say start with 30 minutes, start with 5 minutes, start with 10 minutes, whatever the body allows when you start. The goal is to bring it up to 30 minutes, 5 times a week. Well, if someone has other kind of interest in other kind of exercise, we are talking about yoga, which has become mainstream in the Western world, and it's very important that we keep the benefit within our society here. I mean, if you go to US, I mean, there's huge movement towards yoga. The benefit of yoga is strength and balance. Now, why is this extremely important for our seniors? The number one cause of bed-bound status in seniors is fall and fractures. My cardiovascular exercise, the walking, running, does not prevent fall and fractures. It's yoga and Tai Chi. I'm not sure whether I have any kind of medical fraternity in the group. We need to have a lot of research and publications on yoga. Believe it or not, the Western world recommends Tai Chi, and this is in Sloan Kettering. This is the number one oncology center in the world, and they recommend acupuncture, they recommend Tai Chi for prevention of fall and functional decline. And we need to have more internal research and publications on the benefits of yoga, scientific publications, and I strongly support it. I mean, I'm sure it should be more mainstream and scientific publications, and I'm very well aware that that will be followed throughout the world. Now, strength training is extremely important to keep our bone healthy, especially the weight training, the resistance trainings, and Pilates. So, if someone asks me, you can mix and match. You don't have to walk every single day. You could do yoga one day, you could do walking the other day, you could do strength and resistance the other day. So, mix and match so that you are including all aspects of exercises. Now, this could be the perception of when I prescribe exercise. This is a cartoon there where a wife is telling her friend that she's hiding the TV remote so that the husband is walking inside the home at least a couple of minutes a day. So I did see a recent ad from, I believe it's a Hindi actor Akshay Kumar, who's really recommending people that if you're able to take a stair, take a stair. If you're able to get out of a bus stop, train stop, walk 2 blocks, walk 2 blocks. For all the privileged people here who have help at home, they're doing disservice to you. If you're able to do things for yourself, continue to do that. Especially when we all age, I tell my caregivers who come along with my senior patients, if they're able to eat, if they're able to bathe, if they're able to dress themselves, please let them do. It takes time. It might take 15 minutes. please do yourself. Please let my seniors do as much as they can. The body becomes complacent. The body forgets, we call this as ADL, activity of daily living. The body forgets these activities so quickly when we all age, and it can be, if I have to quote an example, a marathon runner who's probably a very active or cardiovascular wise the most potent, fit person. If I put a marathon runner in a bed for 5 days, they decline. Forget about everyone else, all of us who are not marathon runners. So we all decline. So let's start doing things for ourselves. So nutrition, I can stand here and talk about nutrition the whole day, and India interestingly has different kinds of food, different kinds of area. But I would say be aware of at least the calorie-wise, the glycemic index, the amount of sugars you're taking in. So nutrition becomes an important part, and I see the meat obesity, the abdominal obesity, which is becoming a major epidemic in India, which contributes to obesity, diabetes, and high blood pressure, which is very, very important. So I can stand here and talk about it, but at least start with moderation. If you're drinking regular milk, turn to skim milk. If you're eating whole wheat bread, if you're eating regular bread, change to wheat bread. If you're cut down on your sugar, cut down on your salt intake. Small steps. I'm not asking we are not recommending a significant diet change. These are small steps towards your health and sustainable steps towards your health. Alcohol beverages, no more than 3 per day. Now the question comes, when I say red wine is good for health, good for memory, the question comes, how much red wine? Technically, the definition of red wine is probably somewhere between 4 to 6 ounces. So the Mediterranean population who have longevity, the Italian population, it has scientifically been proven that around 4 to 6 ounces of red wine is absolutely helps in longevity. The active metabolite of red wine is resveratrol, which is definitely known to be an anti-inflammatory and antioxidant. So this is readily available, and I'm sure this will be accessible to everyone here. This is a food pyramid. If you really focus on it, spend some time, you'll really understand where I'm coming from. The whole grains and legumes, where majority of our Indian food are, we are allowed at least 2 to 3 servings and no more than that. We start with grains, we end with grains, which is actually not a good choice. Now, this is based on Western world, but again, this needs to be catered for individual patients. On average, when we continue to age, our requirement of nutrition goes down. So we need to ensure that the energy which we are taking in, we continue to make healthier choices, more vegetables, more baked, cooked vegetables rather than sautéed and fried foods. And the calories have to be cut down. I mean, it can go anywhere between 1800 to 2200 as we all age. But this is again the Western world, the data, majority of our elderly patients do not have decent intake. Medications, this is my favorite topic, because at least in the Western data, if I have to tell you, every dollar we spend on managing a patient, $1.25 we spend on managing the side effects of the medications. If at all, if nothing comes out of this conference today, I would say each one of you should be your own advocate. Physicians have the power to write the prescription. You should know why is it being prescribed, what are the potential side effects, what are the potential drug-to-drug interactions that you might have, and what is the endpoint the physician and you collectively as a team looking for. So this is an extremely important topic, and the reason I'm saying this is the big problem associated with it, and I see it in elderly, I see it in seniors constantly, because they get prescribed multiple medications, they do not know what they're taking it for, there's duplication of medications, and the side effects are not managed appropriately. So now, polypharmacy, meaning it's very easy. If someone has 2 different conditions, let's say someone has diabetes and high blood pressure, each one of those individuals would be on minimum of 4 to 5 medications. And that gets added on in different setup. Let's say they see a cardiologist, they see a regular internal medicine doctor, so it keeps adding up on each visit to different doctors. The number of medication increases, the number of side effects increases. So that's something which I would say unless each one of us take that advocacy role, things will not change. Complementary medicine. So we have a melting pot of complementary medicine in India. We are talking about Ayurveda, we are talking about homeopathy. I'm not an expert here, neither do I discourage this kind of medicine. I'm not trained, neither do I have decent information on it. The only thing which I would ask you as consumer is there any evidence-based research? Is there any evidence-based outcome? Most of the complementary medicine are extremely good choices for prevention rather than treatment. So that's something, and if we don't have evidence-based research, the fault lies within ourselves. Because pharmaceutical industry, which is allopathic medication, they have an interest in publishing, investing in their research. We don't have in complementary medicine. So that's something maybe the governance should be focused on. That's evidence-based research and publication so that we can come under mainstream. And even westernized world, I'm talking about Cleveland Clinic, I'm talking about Mount Sinai, these are big healthcare systems in the United States. They've started a division called integrative medicine, where they're trying the Chinese medicine, they're trying the Ayurveda, they're trying acupuncture. I'm talking about last 12 years, the publication on acupuncture and the benefits of acupuncture has gone up from 2,000 to 15,000. So it's huge. So that's where probably we should come from. I mean, establish the benefits of what we have. So cancer screening, this is something which, like I said, we have to go back to a proactive mode. If I ask and hand raise in the audience here, how many of you go for an annual checkup? Excellent. Decent group. Very good. So that's something which is very important. Annual checkup, I see the advertisements around saying, oh, this is, there is a blood check, there's different kinds of choices you have, especially in the private world, private corporate healthcare. But you should be knowing what you're going for in annual healthcare. It's not just a blood test. We are talking about cancer screening. Again, if I ask for a hand rise for someone who's 50 and above, how many of you have gone for cancer screening? So this is, this should be a quality indicator from the healthcare delivery perspective. But again, if we don't advocate for ourselves, no one will until it becomes a legislation in this country. So we should be really looking out for that. So starting with mainly both men and women, colorectal colon cancer screening. It starts with the age 50. We talk about colonoscopy every 10 years. If people are not very willing to go for colonoscopy, the second best choice is go for stool testing for occult blood. They check for blood in the stool every year. But I would say the preparation of colonoscopy is the little bit of painful process, but if you get it done once and if it's a clean colonoscopy, you're good for 10 years. So that's something we should be really looking for. We don't have cancer screening for all different kinds of cancers which are out there. We have for few. Take advantage of it. Skin cancer, again, because we have enough sun exposure in the tropical countries, incidence of skin cancers, squamous cell cancer and basal cell carcinoma of the skin is extremely high, gets unrecognized until late stage. So when you go for your annual checkup, please ask your doctor to do a complete skin check and see if there is any suspicious lesions. They might have to do a biopsy and take care of it. And these are curable cancers if it is caught on early. Curable. I'm not even talking about maintenance. So if you're going for annual checkup, ask for it. Testicular cancers in men, if you ask me, there are two different kinds of cancers which are easily cured. One is testicular cancer and other one is lymphoma. I think one of the famous cricketer was cured of testicular cancer in the recent past. Prostate cancer for my patients who are 50 and above. It's either done by a rectal exam. It's not a pleasant test to go for men, but it's once a year, or it can be done by a blood test. So when you go for your annual checkup, these are the things which you need to ask your doctors to do. Now for women, I was asked to, because I have women audience, I was asked to talk about women's health specifically. Apart from psychosocial issues, but again, cancer screening in women is extremely important. The incidence of breast cancer has grown significantly in India. So screening for breast cancer starts at the age of 40. We stop by 75 because the benefit really outweighs, the risk of continuing to test outweighs the benefits of screening. You continue to examine yourselves every month after the menstrual period, as well as go for mammogram at the age of 40, and every year, preferably every year. Now, if you have any family member with the breast cancer, youngest family member from the mother's side, maternal side, let's say if you had a family member from the mother's side who was afflicted with breast cancer at the age of 35, you start screening 5 years before the youngest family member. Not from the father's side. The inheritance, the gene inheritance implications come from the mother's side. So breast exam, self-exam, nothing breaks it because you don't see the doctors frequently, but examine yourself every month. Cervical cancer, as we speak today, no one should die from cervical cancer. I mean, it's extremely poor healthcare information if we have patients dying from cervical cancer. So we start doing pap smear tests when a person becomes sexually active, 3 years after sexually active, and we continue to screen them until the age of 65. Bone density. Once we reach menopause, I'm going to talk about menopause briefly, the benefits of the hormone goes down. So the bone starts getting weak. So go for bone density screening. If not every year, the recommendation is every 3 years. So it's extremely important. Why? Because of osteoporosis. We women suffer from osteoporosis significantly, and sometimes we take this for granted. We say, oh, our grandmother, she's shrinking in size. Why someone is shrinking in size? Because they're getting osteoporosis. Someone is bent over. Why? Because now they're having compression fractures of the spine. Osteoporosis, for a large extent, if I have to explain it in a non-medical term, it's like bank deposit. Throughout your younger age group, from 30 on, the more you deposit calcium in your bank account, the stronger the bone is. The good amount of calcium intake, that's around 1,000 international units every day, keeps the bone stronger, along with what I said, your weight-bearing exercise. You continue to do that. Start now. If you have not done that, start now. Never too late. Continue your calcium intake, 1,000 units until you reach menopause, and little higher dose, 1,200 to 1,500 units once we reach menopause. Menopause itself, there's enough psycho-emotional burden on women, which most women go through it, unfortunately, without much support. So the age of menopause varies. Along with menopause, you do see significant change, the mood changes, the weight gain, as well as what I talked about, the hot flashes, etc. One thing that you all should know, that whenever a man has a chest pain, the emergency room physicians run to do cardiovascular testing immediately. Oh, it could be a heart attack. And this data is not just based on, I'm not talking about India, I'm talking about even Western world. If you have a woman who's reached menopause, is complaining of chest pain, you take that seriously too. Even all women have to take that seriously. It cannot just be a gas pain. The risk of having heart attack equalizes once we all reach menopause. The risk of having heart attack and serious heart injury is equal. So that has to be, even the healthcare provider, we do have, as a healthcare provider, we have our own barriers when we are assessing a patient. So you can advocate for yourself. Now, eye exam, the problem as we all age, there are 3 types of issues which comes to sensory screening. One is glaucoma. Again, how many of you have done a decent eye exam other than someone who had an issue with the vision? Excellent, excellent. So we have to have screening for glaucoma, which can there are two different kinds of glaucoma which can really blind us, and it has become one of the leading causes of blindness in the westernized country. The second thing is cataracts, screen for cataracts, and the third thing is something called macular degeneration. This is where you see senior patients falling because they tend to have central vision, the peripheral vision goes away. So at least every 3 to 5 years, get yourself checked out for these three, not just for the vision, not just for the glasses. Hearing assessment for my millennials who are in their 20s will have an issue with hearing when they reach 50s and 60s because the iPod generations, the issues with the music and the will be increased exponentially. But at least when you see a physician on annual checkup, it's a basic clinical test. They can do a hearing assessment in less than a minute. Now, immunization, this is a huge push. Winter is coming in states like Delhi and Northeast. So we need to actually be aware of what are the immunizations that we should be getting. Influenza, flu vaccine. Again, if I have to see a hand raised who's aware of flu vaccine and what are the implications of flu. So it's actually administered, it's an option, it's administered at the age of 65, and we administer strongly, we recommend strongly every year at the age of 65 in the winter months. The flu vaccine is offered every month in the winter months. Meanwhile, pneumonia vaccine is offered once in lifetime after the age of 65. So it's something that you need to get yourself immunized, as well as the shingles vaccine. Shingles vaccine is again one dose after the age of 50. If anyone in the group has suffered from shingles, they know how painful the lesions are, and the effect of pain could long last significantly. And if I have a senior at the age of 60 who gets shingles, I know they're going to spiral down decline very quickly just because of pain. So if you can prevent it, why not? So flu vaccine is an option here. Technically, you don't see that kind of coldness here, but at least I would strongly recommend pneumonia vaccine and shingle vaccine because it's once in lifetime. So other recommended tests, I'll come to basically, unfortunately I'm touching them briefly. I'll be more than happy to answer any questions at the end of the talk. So we are talking about diabetes. Like I said, this has become, unfortunately, India has become the capital of diabetes. Now, diabetes, it does not come in on its own. It comes in with multiple organ failures, right? I mean, someone who does not control the diabetes, the three major organs which gets affected is your heart, the eyes, and the kidney. So pretty much everything comes in there. And this is, it's a disease where if you take care of the disease, if you advocate for yourself, if you invest in yourself, you could have pretty much a normal life. This is something which you need to be aware of. Specifically, we strongly recommend eye exam once a year for someone who has diabetes because there's something called diabetic retinopathy which can cause blindness. You need to see an eye doctor once a year. You need to go for a blood test called hemoglobin A1C. This can be done 3 to 6 months, even though in the United States we do every 3 months. It can very well be done between 3 to 6 months. And the goal should be less than 7%, irrespective of what physician tells, where we go by American Diabetic Association recommendation, it should be less than 7%. The more than, it's between 7 and 8% you're seeing the damage to your eyes and the kidney. So the tighter control in your younger age group, I'm talking about less than 70, the better for you throughout your life. You also check your urine once a year so that if you start spilling protein or albumin in the urine, that means the kidneys are giving away. Technically, the kidney doctor, the eye doctor, and the heart doctor cannot do anything by the time you see these because the damage is already being done. This is like train in motion. You know, once the train starts, you really can't stop it. You can slow it down. So the better thing is invest in your diabetes management and let not the train start. You know, that's very important. So high blood pressure, there's huge debate. What is normal pressure? And you know, it changes with age. That's not true. You go by the, again, international guidelines. The normal blood pressure is somewhere, the higher top number is called systolic blood pressure between 120 and 140. The bottom number somewhere between 80 and 89. That's it. There's no debate on that. No higher, no lower. So if you have lower pressure and you feel fine, that's good for you. That means you have better numbers. If someone has been diagnosed with recent high blood pressure, of course, other than regular cardiovascular exercise, you watch your salt, you watch your intake of alcohol, you watch your intake of smoking. Now the question comes, how much salt? The doctors will say 2 grams sodium salt. How do you know 2 grams sodium salt? Pretty much if someone has gone through too much 2 grams sodium salt, it's pretty much very, very minimal salt. So I would say cook with salt as less as you can tolerate. That's the bottom line. Now high cholesterol, again an epidemic, not just in Western world, in India as well right now. You need to know what are the numbers, correct? There's good cholesterol, there's bad cholesterol. I have the numbers here, so I'm not going to go in detail, but you need to make sure that your numbers are appropriate. Just because if you let this grow, let's say someone has just high cholesterol, what will happen if you don't take care of it? You will have problems with circulation at the end. I'm talking about 15, 20 years after. You will have problem with the heart. You will have problem with potential stroke in 20 to 25 years projected time when you get diagnosed with high cholesterol. There's a lot of debate on fish oil and omega-3 as prevention. Absolutely, it helps when you have a kind of cholesterol called triglycerides. If it is high, these supplements definitely help to come down. But nothing beats changing your lifestyle. Nothing beats changing your food intake. Now, the second aspect is cognitive health. This is pretty much my specialty as a geriatrician when I see a huge burden of patients with dementia. I was once asked to compare why Indian subcontinent did not have dementia versus Western subcontinent. My answer to them was, I'm comparing apple and oranges because it's two different ways of life. We still do not understand the onset of Alzheimer's disease. And then also the longevity is different. It's almost a decade and a half longer in the United States compared to Indian population. Alzheimer's seems to be a huge burden in westernized society, and you're seeing an increased encroaching onset even in India right now. The Time magazine ran a front page article not too long ago because it was originally identified 100 years ago. We still do not have an answer. We have some understanding of how dementia onsets. We don't have a cure. We don't have treatment currently. So then how do we prevent it? I tell my patients, like the cardiologist tells you to walk, I tell you to work your brain. You need to work your heart. Cardiologist tells you to work your heart. I'm telling you to work your brain. Now the question comes, how do I work my brain? Anything routine, the brain has adapted to it. Let's say if you're walking one street, the brain knows you're walking. You're not thinking, you're walking that street. Change the pattern. I'm just simplifying it. Change the pattern. Do some kind of cognitive exercises. Now what are the cognitive exercises? Someone who has some time, do the puzzles which is available, right? I'm talking about crossword puzzles. I'm talking about Sudoku. Especially in United States, it's a joke that they're not good in math. When I tell my patients, saying, can you do Sudoku? The next question is, what is Sudoku? I tell them, fill in the numbers. The answer I get is, I'm not good in math. It's not math, it's just filling in the numbers. Or someone, especially our age group, who's next 20 to 30 years, you're seeing increased growth. We all know how to use smartphones. Play Lumosity, it takes 5 minutes. It's very interesting. It works with all domains of brain. Do I do it? Absolutely. I practice it. I play the game every single day. It takes no more than 5 minutes every single day. And one thing which I see that is the moment you let go of your, let's say if you're doing financial control, especially women I'm talking about, continue to be, continue to do that. The moment you let things go, like I said, the brain becomes complacent. Now, the question, I'm constantly asked my patients who have early onset of dementia, is there anything they can take to cure it or prevent it? There's huge debate out there, huge research out there, including ginseng, ginkgo, So what I would say, the current small studies which support it is vitamin E and vitamin B12, because B12 is definitely known to help the brain. The vegetarians in the audience, definitely you could check your vitamin B12. You might be on the lower side. Supplement it. It's simple supplement. You could take a multivitamin. You could take B12. It's extremely helpful. I talked about resveratrol, and the question on anti-inflammatory drugs, meaning your Motrin or your ibuprofen, I strongly discourage it because the side effects of these medications are huge. The only thing which I would say is vitamin E and vitamin B12 for sure. The other small study, interestingly, was on turmeric. The study was not done in India, unfortunately. The study was done in Canada. It was a small study, but there was definitely a positive result. So if someone is taking turmeric pills in Western world, I say take it, no problem. But us, I guess, who are cooking food every day, that there is a huge benefit to it. So I strongly support it. Now, emotional health, I was just having a debate or discussion with the Director General this morning on this becomes huge for the veterans or the Jawans who are serving in the border. Now, the support system, I would say if it's not being done, I strongly recommend that along with the annual physical health, they should have emotional screening or emotional and screening. It's extremely important, just because the post-traumatic stress disorder, even though that has been redefined, the anxiety, the depression sets in, and there is a social taboo. So it can be a confidential assessment every single year, and there is increased risk of suicide, increased risk of prolonged depression and anxiety in people, especially with veterans. So this, if we can address it, it's very helpful. Even spouses of the veterans who are serving the force, I mean, it can be a confidential annual assessment, and it does contribute to the physical health in some way or another. So lastly, the social factors, which actually within our subcontinent we are very lucky because we still are in extended family or extended social groups associated. It's not very much there in Western world, but to keep the friend circle, continue to volunteer throughout your adult life as well as senior life. I truly have seniors who are 80-year-old, 90-year-old. They come to the senior home, and if they're functional, if they're able to do, they contribute. So continue to be engaged in your social life. That's extremely important. Again, lifestyle choices. This does not happen overnight. This is a commitment which you do throughout your life. Even you start now, and for next 20, 30 years, this is a commitment which you have done, and you will definitely see the benefits of the changes. Neighborhood effects. This is more again towards the Western world, because you see coalition of senior homes in Western, but that's something which is not available here. That's something which probably, if we are seeing an exponential growth of seniors in this country, we might be looking at adult living facilities or group homes where they live independently, live with dignity, but they have their own peers to engage with. Now, this coming back to the same slide which we started off with. So, if we have anyone in this the first age group, choose invest now. You start talking about, I see only one person out there in the front row, Devanshi is there. So when you start thinking about change now, because things will happen in next 5 decades or so. For the most of the people who are sitting in our group here, things will change in the next 20, 30 years, but we don't want to sit on it. Let's start today. Let's start changing our lifestyle today and invest in ourselves and be you be your own advocate for your health. You need to question the so-called healthcare authority. You need to educate yourself. You cannot take the recommendations. If you do not question, if you do not be advocate, there would be no improvement in your own lifestyle. And lastly, for my senior patients here, I know I was introduced as a palliative specialist for someone who's aging, who's transitioning. Let's be sensitive for the changes which is happening, because one day we all will be there. So let's support them as much as we can, both socially as well as physically. But one thing, if they're able to do things themselves, like I said before, let them continue to do it. But we need to give them the highest quality of life as best as we can, as well as the dignity. And throughout the last 30 days or 40 days of their life, unfortunately we do not have a system, but that's something which I would love to work with the legislation here to implement palliative care for people who are actively transitioning, because they die with as painless as we can make them. So, any questions? I'll be more than happy to take questions, or if my email is here, I'll be more than happy to respond to the emails and questions if it comes after the session ends. So I'm open for any questions. If there are any physicians here, I'm not sure. If they are here, then I'll be more than happy to answer their questions, if not even for the regular public. Yes. Okay.
What are the psychosomatic problems that
Emotional health, absolutely. So, apart from being a veteran, apart from being a person who serves in the border security force, as we all age, there's increased incidence of depression in elderly. It's because of social isolation. It's because of the body which changes, which do not get recognized. At least in the westernized world, when we are seeing patients for the first time, we screen them for depression and we treat that. There is increased incidence. I would say at least 60 to 65% of seniors do have underlying depression. Now, if you don't treat depression, that can contribute for onset of dementia in future. So, apart from depression, there is increased incidence of anxiety and psychosis, but that's more with end of the trajectory. When you're seeing an advanced dementia patients, then you see a lot of psychosis, a lot of sundowning, a lot of anxiety. But I would say, if you ask me, the main diagnosis in emotional psychosomatic health is depression. That's actually a wonderful question. I mean, the question, if people didn't hear, is like, is there any kind of literature, correct? If there's any kind of literature available to help ourselves on emotional health. There is vast amount of literature. There's scientific literature too. There's vast amount of literature available on educating ourselves, because with the onset of Google and onset of if you just say emotional health in elderly on Google, there's enough information which is available there. But I would say, for people who love to read, just to keep themselves emotionally and cognitively functioning, let's say I like to read autobiography. I would like to change it. I'd recommend them to change it to read fiction. I want them to change the pattern. It's very important. That's for cognitive decline. For emotional health, there are enough books available. There's no one specific book as such, but there's enough literature available online as well as. But I'll be more than happy to share specific. I have more Western books which is available, but I'm sure I can do the research and I'll be happy to share it with DG Sir for sure.
Hello. Regarding books, I was just mentioning, like you said, emotional health. So there are books like Goldman has written, he's from the US only.
Correct.
And those books are just dealing with the emotional health, and they have made the subject so typical and so scientific and so technical that a common man, particularly our troops, will not be able to really understand what all it's all about. Then suppose we want that book reading. Now, what kind of should the books be about history or fiction, or the fiction of what kind of fiction? Because fiction can even create tension also. It can create that kind of mindset, so that if it coincides with their mental psyche, then it can even put them in tension.
Absolutely.
So what kind of fiction? So little bit about it.
So first, I think I would divide that into two aspects. What you're asking, number one, is there any more less scientific literature available for addressing the emotional health? There are some very famous social workers there who have published, books on psychosocial health that I'll be more than happy to share. But the other question comes in with what kind of to keep the cognitive function, what kind of fiction? Honestly, if you ask me, there's no scientific, because each one of us are different. Each one of our emotional journey in life is different. So it's very hard for me to say one book is good for all. I mean, what I'm trying to say is for the cognitive health, if they like to read one kind, they need to change it to other kind. But it's individual journey. If they have some kind of life stresses, and if that book is triggering those kind of emotions, it's very hard for us to prescribe that this book is, unless you have a relationship with that particular, as a physician, it's very hard for me to say this book works for all.
Regarding the calcium intake, you had mentioned that particularly for women post 45, post-menopausal, they should be taking 1000 to 1500 mg. That has been the conventional wisdom, and it is accepted all over the world. But recent studies have shown that those who take calcium in the form of supplements, they become highly vulnerable to heart attacks.
Correct.
There are a lot of studies. So, what do you say? What is the other alternative for calcium intake so that you take calcium and also do not become vulnerable to this? This is what the recent studies.
Correct.
Second question is regarding myself and few of us who are vegetarians. We find that vegetarian food generally is deficient in vitamin B12 and B6 and also folic acid, etc. So, what sort of natural supplements you will suggest for vegetarians?
Right. So the question is vitamin, the calcium intake and increased risk of heart disease. There was a small study which was published that increased calcium intake can increase the risk of, we call it as atheromatous plaques. That means it's like a small calcium lining inside the artery. These studies thankfully were not big enough it was not a consensus to say do not take calcium. So natural calcium, of course, anything which we can eat naturally, if we can supplement naturally, it overtakes supplements. The question is, can I suggest any food which is high in calcium? We all know most of the dairy products are very high in calcium. Your yogurt very high in calcium. Broccoli is very high in calcium. But the consensus regained, the NIH came back, National Institute of Health came back and said 1000 international unit of vitamin D and 1000 milligrams of calcium is good enough, and it does not increase the risk of cardiovascular event. So food which supplements with high dairy product, including eggs, yogurt, milk, cheese, they all have a good calcium amount. And the second question is for the vegetarians. I'm a vegetarian myself, and definitely the concern is vitamin B12, folic acid deficiency. There are very few food in vegetarian choices which has good vitamin B12 amount. So the range of vitamin B12 for the knowledge goes from normal range is around 200, it goes up to 800. The studies have shown, including the physicians, when they look at the labs, if the normal level is around 200, 250, they might say you're normal. But the damage to the neurons in the brain occurs when you fall less than 350. That includes, this recommendation is for non-vegetarians as well. So we have very, very few choices of which we can have B12. So I would say for us, the good option is B12 supplements. There are different ways. We can give injections once a month, which is painful. Or there's vitamin B12 supplements which we can take. It comes in gummies, and there is inhalation right now, which was released in the United States. B12 inhalation is 1 pump once a day.
Ma'am, I just wanted to refer to your statement regarding this Ayurvedic prescriptions and the large following in this country. Ayurvedic system of medicine. It goes back to many, many years, many centuries perhaps.
Centuries.
And notwithstanding lack of scientific evidence, which you referred to, they do have a lot of systemic information on the good things about the Ayurvedic medicine. And this seems to be driving more and more people towards Ayurveda now, more than ever in the past. And I think it has yielded many positive results, probably scoring over the allopathic systems.
That was one of my comment when I said I definitely do not discourage because I've been born and brought up in this country. I believe in it, but when we are talking about within our own country, the acceptance is absolutely there, but we need to be on the international platform. There is vested interest with pharmaceutical companies on their research. There's billions of dollars being invested. But why can't we have our own evidence-based research and publish? That's what I was commenting on. So that we'll be on the international platform. The current acceptance of alternative, I would not say complementary, alternative medicine is more towards prevention. The moment we start establishing that it does help in curing and treating, we are in different league. Absolutely.
Study regarding the effect of cholesterol. In some of these recent studies have been quite positive, not so negative. I won't say positive, not so negative. That is one aspect of the. Secondly, the intake of fat has recently been shown to be good towards health. So on these two issues, can you say something?
Right, that's actually very interesting. This is not too long ago, and I'm different kinds of saturated fat. So the studies, the reason that came out, because when we went into that non-fat mode, there was an increased intake of fat, which was actually contradicting the recommendation. So yes, in moderation, saturated fat, specifically the ghee, and we've come back around circle there, ghee and coconut has been found positive, but again comes back to moderation there. And the cholesterol, in fact, the lower the cholesterol is lower than the normal recommendation, there's increased risk of mortality. I agree with you. So there should be a very thin balance there.
One of the professional hazards for soldiers is that most of the time they live alone in the border in their duties. So as they age, what kind of the emotional and cognitive problem they face, and how to prevent it in this state?
Prevention, I would say, might be extremely difficult because they're going through the harsh exposure. But one thing, almost everyone who goes to annual checkup should have emotional screening as well by the psychiatrist or psychotherapist. That's one way we can prevent, because if there is an onset of slight onset of anxiety, retire, and if it's not done, unfortunately, they do end up in very significant amount of depression or post-traumatic stress disorder, and will have no choice other than prescribing them medications. So my recommendation is they should have very close and very extensive emotional screening annually.
Really strong, so that doesn't happen to him. So like you have prescribed medicines for post say 60 years, say for old. So in forces also, like at a particular age it happens that people do start having this psychological emotional kind of role. So if we can prescribe them certain kind of food or certain kind of medicines they can continuously take, and so that their emotional health becomes, other than the book reading and those kind of things, that will help.
So the question, the comment or the question is, can we prescribe any medications? Can we prescribe any food to prevent emotional decline, and can we possibly not do the extensive screening and treat them? The answer is actually I would disagree, because it should be a confidential. As we speak, we don't have a medication which can prevent any emotional decline, but again, like I said, the stresses individual goes through would be very different, and there is no specific food which can prevent any kind of anxiety. But the reason I'm saying this should be, first of all, the soldiers who are going through this emotional screening should be assured that there is no implications unless and until there's some drastic, because they definitely would go through some kind of changes through their career, correct? So screening and referring them to psychotherapists confidentially, because there's patient confidentially is extremely important. If it's sent to not just to psychiatrists, even to therapists, that resolves a lot of emotions, right? Not medications alone will not help. I'm not talking about psychiatrists, I'm talking about psychologists. They should be having easy accessible to psychologists when and where they need, so that they can have this confidence, that they can talk to someone in confidence and they can resolve that emotion as best as they can early on, so that you're not seeing in longevity, you're not seeing in long term side effects of these conflicts which they come up with.
I'm Avnish Awasthi. I'm Joint Secretary in the Ministry of Social Justice. We have the entire arm of old age. So I would congratulate you on your presentation, an excellent presentation. The broader issue that we are facing now is we are, as you have rightly pointed out, we are increasingly getting a larger percentage of the old population. In terms of numbers, the numbers are very high. So our government, the current government of the Government of India, is not of the view of making old age homes, because that is not our lifestyle, that is not our culture. But then we need to find a solution for the old to interact and mingle and come together with the other old people around, because the younger generation doesn't have the time. The young daughter or the young daughter-in-law or the son-in-law would not have the time to interact with their parents who are probably staying with them. So what would you advise? I mean, I'm just giving you a small example that the old have now taken to social media, being on Facebook, being on the social media, and I have found that it has made them really connected with so many people of their friends all over the place who are all retired, but they are not able to meet, but the social media brings them together. So what would you like to advise India to cater to our old? Because we would not like to put them in old age homes, but still we have the younger generation which is not able to take care as much as it was earlier. The joint family system has almost, it is not there anymore. So why and how do we go forward as an expert?
Thank you. So that's a wonderful thought process that we should have. So Mr. Awasthi, what I was referring to, assisted living is not an old age home. Our perception of old age home is where we desert our seniors to a particular home where they're by themselves. Assisted living community is what I was talking about, neighborhood effects. Here we have a functional senior starting from 65 to whatever they are. They live independently with dignity. We create a society, we create an environment where they live on their own. They live in a kind of society where they're living amongst their peers. And there's a lot of social daycare model which is coming up even in the United States, where there is a community centers where the seniors go in, they participate with various kind of activities, and there's also continuing education programs for what you said, social media. Not every 80-year-old, 90-year-old are savvy enough to access or know how to use. So there's continuing education in every small community for the seniors so they can access, and these are funded by the feds and the states in the United States. So I would say at least create a society or create a neighborhood where reasonable, affordable, kind of society where they can come in, they can live in with dignity, they could have that kind of quality of life which is much needed in their golden life.
Good afternoon, madam. I am DIG in BSF. I am running 60th years of age. I am retiring next year in August 17. I am a regular player of tennis. I play morning 1.5 hours. Regularly I play. But sometimes in evening I say my son, please, मेरे थोड़ा पेट दबा दे. वो बोलते पापा आप बूढ़े हो गए अभी खेला मत करो. But I used to tell him that you don't use this word Buddha for me. Because if you come to court, I will show you what age of moment. So just I wanted to request you, madam, it is my personal request. I want to maintain this my status in the same way after retirement also. In post-retirement period also, I am going to settle in Jaipur.
One of my nephew, he's a member of Jaipur club. He asked me, Kakusa, what do you want to have after retirement? After retirement, I want to play tennis in your Jaipur club.
Okay.
Nothing else I want. So just I wanted to ask madam, what diet should I carry on with that age? Because other day I was reading regarding Pushwan Singh. He played tennis up to the age of 80 years and he died at the age of 99 years. Of course, I don't want to die at the age of 99 years, but I want to play tennis up to the age of 80 years. So just dietary control, you please let me know.
Yeah.
Thank you.
So, I mean, exactly. If you heard me saying on the physical exercise, I said if you're able to run, run. I mean, as long as you make sure that you're taking care of your knees and the ankles, we have to make sure. If you're able to play tennis, continue to do it. No one stops you from doing it, unless and until you end up in injury that you need to take care of your, make sure that you're wearing the knee braces or the ankle braces, because that's when you start having wear and tear injury. There's absolutely no contraindication for you not to play tennis, because the longer you're active, I mean, that's good for you. So, and again, I started off my talk saying age is stigma. So, for the group here, my oldest patient is 103-year-old. And she comes to see me with her boyfriend who's 97-year-old. So it's all in your mindset. So if you continue to be active, in fact, that's what we recommend. And again, food in moderation. We're talking about lesser fat, more natural food, vegetables, unprocessed food. It's extremely important. And continue your lifestyle as long as you're able to do it. That's fine.
So, my last question, ma'am. What is the concept of reinventing ourselves at the age of 60? Because I have heard about some stories that they really reinvented themselves and they found out that they are having hidden talents and then they want to develop those things and nullify the effects of the old.
So it's very subjective. I guess 65 is what WHO defines. Like what he's saying, he's 63 and if he wants to play tennis after his retired life, that's it. So reinventing yourself is very subjective, I would say. I guess it's probably the point of interest which you've had, and if you're unable to do throughout your career, that's fine. It could be as simple as photography. It could be as simple as painting. So that's reinventing yourself in a different direction. No more questions. Thank you very much. Thank you.
Thank you. How to age successfully? So a combination of exercise, nutrition, keeping a watch on the side effects of medication, preventive screening, and what are the various target goals for various biological and psychosomatic parameters. I think has been absorbed very well by the audience and has certainly had a lot of us thinking not only about our future but also the future of our men and women who are deployed on the borders under very sometimes very stressful circumstances. I would now request President Baba to present a memento on behalf of all of us to Dr. Rekha Bhandari. Thank you, ma'am. Thank you, sir. Sir, may I also...
It doesn't call for a vote of thanks, it calls for a big clap. Ma'am, I must tell you, I've heard so many lectures on healthy aging, and this is one of the best lectures I've heard. And it makes an impact, probably it comes from a practitioner. You have been practicing yourself, so whatever you say, it has an impact. And a few things which I have picked up from your lecture, I am quite sure everybody would have. But to me, number one, body tends to forget things if we don't repeat them. But at the same time, if we keep doing the same things again and again, body needs to change its pattern so that the creativity is maintained. So eventually, how we maintain our laughter, the gratitude and the creativity in life, and I'm quite sure the way you have taken a holistic view of the whole topic, right from starting with the body, the various intakes, the food, the medicines, and also The emotional aspect, also the cognitive aspect, all the aspects in the alignment between all the three. We thank you once again, and we will be getting back to you again. And thank you for sharing your email with us, so that we'll be getting more out of you wherever we need. And thank you for giving us this assurance on behalf of BSF and Director BSF.